Wonderful to see you. Well, Dr. O, I'm gonna kick it off, but I first want to just introduce you briefly. So yes, thank you so much for being here with us today. This is Dr. O. That's our nickname for her, because I would absolutely massacre your last name, I'm afraid. But Dr. O is a movement disorder specialist and neurologist at Barium Neurological Institute in Phoenix, Arizona. They have a very large HD practice. I think last I heard, and this was a while ago, I think you had at least 80 people that you see with HD, and probably more by now, because that was several months ago. So it's a very large, comprehensive program with social workers and, a very large comprehensive program for people with HD. And we're really honored to have you with us today to speak about living well with HD. And we will open it up to questions after you talk for a little bit. So I'll let you take it away.
Okay, well, thank you so much, Sarah, for the introduction, and also thank you, PMDA Alliance, for giving me an opportunity to talk about Huntington disease care again. And today, my assignment was talking about living well with HD. And when I think about it, it's quite a broad topic that there are many things that we can talk about. And with the limited time we have, I decided to focus on one topic today. So I'm going to discuss about diet and nutrition for Huntington patients. And I hope it will be useful for many of you. And as many of you already aware, just an overview of Huntington disease. So Huntington disease is a disease that can affect a person in multiple ways. Basically, there are three main categories of symptoms. One is the physical symptoms. The second one is the cognitive symptoms, cognitive change. And the third one is the behavioral or mood change. So there's different things that can happen because of all these things that are affected by the disease. So I would like to focus on diet, because one of the common physical symptoms that person with Huntington patient experience is weight loss. Yeah, so weight loss can happen early in the course of the disease, or it can happen during any time during the course, of the illness. And, when you think about it, there are many reasons that Huntington person has weight loss. You can imagine, one of the most likely cause of weight loss in Huntington person is the abnormal involuntary movement. In Huntington disease, the person usually have involuntary movement called chorea, which can be mild, but sometimes can be severe. And, when you have the movement pretty much all the time, your body burns more energy. So, make you lose weight in that way. The other reason that Huntington person lose weight is because of the disease itself. Because we can tell that, even in some case that the patient doesn't have the chorea, they can still lose weight. So that part of it is from the disease itself. And we still don't know exactly yet what mechanism that the disease affecting the body that caused this weight loss. Then as the disease progresses, many people will also notice difficulty swallowing. The involuntary movement, the inclination from the disease also cause difficulty for the patient to feed themselves. So that's also another reason that patient may lose weight. And also maybe difficulty accessing for the food if the patient lives alone and has limited care. So they may not be able to cook anymore because of the symptoms that's been progressed. And also as the disease progresses more, the cognitive function become more and more affected. So Huntington person may not remember or able to remind themselves that it is time to eat. So there's all these reasons that add into the picture that make Huntington person lose weight. And from all these reasons that with all the involuntary movement, the disease affecting the body, So Huntington person will need to eat high calories diet. So normally for most of us to maintain our body weight, there are many factors that play, into it. So depend on your age, your sex, and also your level of activities. And with Huntington person, they have more physical activities because of this career, so they need higher amount of calorie than normal. So in normal person, in woman, to maintain your weight depend on your physical activities, your age. It can be around 15 to around 1,500 to 2,000 calories a day. And for men, it can be up to 2,000 to 3,000 calories a day. So that's a good amount of food that the person had to eat to able to keep up with that calories. So what kind of diet that will help increase the calorie intake per day? So for example, you can try to eat more meat, and you don't have to use or eat very lean meat. So you can do more, meat that has more fat in it. When you cook, you can put more oils, more butter, more margarine, all the kind of fatty food that a lot of us cannot do because it will increase our cholesterol and make us gain weight. Those are actually helpful for our Huntington patients. There's a lot of good sorts of fats, for example, peanut butter or any nuts butter will be helpful. Olive oils, is good. Also, a lot of time we should avoid and stop ourselves from eating sweets, but those can be a good source of calories for the patient. For example, ice cream, cake, cream cheese, all those things can help increase the calorie for our patients. It is helpful also for Huntington patient to eat food that rich in vitamin B12 and antioxidants, because those are substances that will boost up our nervous system function. So the source of high B12 diet are things such as meat, dairy products, eggs. So, these can be helpful for the patient. And also for antioxidant, basically any vegetables and fruits with different colors, carrots, tomatoes, beetroots, or different kind of fruits, vegetables with different colors, will be a good source of diet for them. And early on in the course of the disease, it can be actually easy for the person to, try to eat more of different kind of food to increase their calorie intake. But after the disease become more advanced into the mid stage of disease, it can be more difficult for Huntington person to swallow. So then there will be some change that we have to help the patient in order to swallow safely. So, when, you start to notice that the patient cough, or, choke when they eat or drink, then it's time that you should alert your doctor that, Huntington person start to have swallowing difficulties. So they can refer the patient to get testing, such as swallow evaluation and modified barium swallow test. So what happened with these tests is they will have the patient swallow a contrast, which is a barium. And then as the patient swallow the barium down, the swallow therapist will be able to visualize, when the barium passed through the person's throat and see if there is barium that penetrating or aspirate into the lungs. So they can tell by that way whether there is any aspiration. And then the swallow therapist will have the patient swallow and drink different kind of fluid and food to see which kind that caused the person a problem or which kind is safe for them. And they recommend the appropriate diet for them. But in general, when the swallowing problem has worsened as a disease progresses, it is usually helpful to eat food that is soft and moist. So it's easier for the person to swallow the food down, and avoid food that is dry and crumble, because that can easily cause a choking hazard. And when you have Huntington person eat, try to avoid any distraction. Try to have them focus on just eating, because when they not pay attention, it'll put them at a higher risk of choking. You know, when you have a patient eat, try to have them sit up straight, and also watch them when they eat, because it is very common for Huntington person to be impulsive, especially when they eat. So then they tend to put too much food in their mouth. So it's helpful to kind of watch them and help remind them gently that, you know, to avoid putting too much food in the mouth. And using smaller utensil may be also helpful. And also cutting food into small pieces is another way to help with this problem. And as the disease progresses, many patients will actually forget that it is time to eat. So it will be our job to help remind Huntington person that it is time to eat. And when the cognitive problem is still not advanced to severe, you may be able to set an alarm for the person to remind them to eat. But as the disease progresses, you may need to direct them to the dining table, put the spoon in the hand so that they can initiate the eating on their own. And as the disease progresses more to advanced stage, some patients will have more problems swallowing and will not be able to swallow safely without aspirating food, or they may not be able to eat enough calorie that they need a day. So at that time, it will be time to consider alternative a form of feeding instead of by mouth. The person may need a feeding tube. So the feeding tube come in different form. You know, there's something called PEG tube or GJ tube. Basically, all these procedure is the procedure where the doctor put the tube into the stomach or to the small intestine of a person to help provide food directly into their intestine without, you know, require the person to swallow and put them at risk of aspiration. So when the person needs this kind of alternative feeding, it depends on many reasons. For example, whether the person has aspiration from the testing that we have done, or some patient still able to swallow safely, but they may not be able to maintain enough calories per day. So it should be evaluate case by case on who can get or should get this feeding tube done. And if the person can still swallow by mouth safely without aspiration, the person can still eat food both by mouth, you know, for pleasure, and still can get enough calorie per day by using the feeding tube. Usually, it is helpful to discuss with Huntington person earlier in the course of the disease when the cognitive symptoms are still not advanced. So the person can decide for their own whether the feeding tube will be something that they would like or not, as the disease become advanced and they may not able to make decision on their own. Okay, so that is the kind of summary of the diet and nutrition problem that I would like to discuss for Huntington person, and I would be happy to answer any questions that you may have.
Dr. O, this is Melissa. Thank you for that very thorough information about feeding tubes and such. You know, it's a hard thing to ask your HD person whether they want a feeding tube, but I think the sooner that you do it, the better, right?
Yes, yeah, correct. And I would say sometimes it depends on case by case. In some patient, they're very open and they actually do not feel too uncomfortable when we ask them. Actually, I think it's a good thing to have them also play a role in the decision making on how they would like things to be done when disease become more advanced.
Right. And do you have anything in print as far as a typical diet or a nutrition program that is something that you give to your patients? Is there something in print that we can help pass out to our HD folks?
Yes, actually, that is a very good resource if you log into Huntington Disease Society of America website. On the menu tab on the top, there is a I don't remember the exact tab, but there one of them will have the section that called nutrition. It actually provide good information. That's different articles that was written regarding the swallowing problem and diet recommendation for Huntington person. There's also recipe recommendation. Okay, actually, I'm open it right now. So if you log into hdsa.org and you look at the top, the third menu that say Living with HD, there is a section called Nutrition. There's a lot of resource on that tab. And also if you scroll to the Caregiver Corners webinar, there's also video and other resource regarding diet and nutrition for Huntington person, and also information regarding other concerns.
Fantastic. Thank you. Not sure if anybody else has any questions.
Is there a particular tool that you use in terms of guiding the conversation? I'm thinking of, we have a tool that sometimes we use in our conferences, the 5 wishes. But and actually what we've started to do is we'll have everybody fill it out. So not just the person who has the disease, but everybody, because everybody should kind of have advanced planning. And if we set it that way, then it's kind of like, it's not, oh, you need to plan for this. It's like, we all need to plan because we never know. So the 5 wishes is the only one I'm thinking of. I mean, it's kind of an intensive one, but it really goes through the questions. Are there any other tools that you recommend? Because I think you guys are both right. The sooner the better.
Mm-hmm. Yes. I do not have particular tool or online information I have about these advanced directive information, but we can reach out to our social worker and we can send you further information. Typically, we get all those, kind of plan in advance, including mental power of attorney, which is another important thing that we typically get for the patient in case there's change in the behavioral and psychiatric symptoms. They should have someone who they designate to make decision for them also. I can reach out to our social worker and give you this information.
Oh, that's fantastic. And what we can do is when we send this out, Melissa will put this on the HDSDN YouTube channel, and we'll put it on the PMD Alliance YouTube channel, and we can link these pieces to that as well. I know this is a little off topic, but I feel like it is part of the conversation of living well with the disease. And I know, part of the challenge with these diseases is that they're long, and there's very few doctors with a lot of expertise in the disease. But I also think, I'm just curious about, movement disorder physicians versus like a general practice. I think there can be a thought that, well, since there aren't a lot of medications, it kind of doesn't matter what doctor I see, neurologist or not, because they can't do anything, which I think is probably not true. What you just talked about is the kind of stuff that somebody who doesn't have expertise in Huntington's would not necessarily know about? Like, what kind of food helps? And yes, eat the high-fat food. Go for it. That's not something that a general doctor may know about. I'm wondering if you can just kind of share that, what that difference would be, because we also know that it's hard for people to get in the car and go to a specialist, because it might mean quite a bit of traveling. But if you did that once a year, I'm
Yes.
curious about your thoughts about that.
Yes, yeah. So, depend on where you live, it can be difficult to access to the doctor, to the neurologist, right? But I totally agree with you. At least if you can see at least the movement disorder specialist, which is a neurologist who took extra training, which can be 1 or 2 years, to specialize in patients with movement disorders such as Parkinson and also Huntington disease. I think it will be very helpful because, again, like you say, the movement disorder specialists are much more familiar with this disease, especially Huntington, than the general neurologist. So there's a list of centers that has doctors who specialize in Huntington disease. So there's what we call Huntington disease Center of Excellence throughout the country. So if you log into HDSA, there should be information available there too. Typically, again, it will be a relatively bigger university that has it. But at least if you can see them once or twice a year to get some additional recommendation, and then still can follow up with the local neurologist for more day-to-day issue, or in case you have problem, you can access to someone closer to home. But to see a Huntington specialist, you may be able to learn more about things that you can help yourself or your family members. There may be also opportunities to participate in clinical trials or research in case there's new drugs development. And also the doctor who specialize in movement disorder usually more familiar with new medication that become available for Huntington person. And in fact, I'm very excited for our patient that in the past few years there's much more options in terms of medication treatment that we have available for the patient compared to perhaps 10 years ago.
I think that's really helpful in making sure that we find the doctor, because also there's some research and there's new studies all the time, and I know there's we're looking into some new treatment options. Again, a person who has that expertise is going to know more about those, I would think, than a general provider.
Correct. Yes.
Mm-hmm. Mm-hmm.
So I have a question for you, Dr. O. Telemedicine seems to be the new hot topic lately, and I was wondering, do you think that will be available for our HD patients as well?
Yes, that's a very good question. Yeah, I totally agree with you that the telemedicine will be a very helpful tool for our patient in the future, and I believe many centers may already start using it. We are starting use it in our Parkinson patient in a spatial program, but not for everybody so far. But we are in the process of getting into using more of the telemedicine. Is with the whole hospital, it requires more process to get contract with the company and everything. But I think it would be very helpful resource for our patient whom, especially in advanced stage, will have difficulty coming to the center, to the hospital, difficulty with transportation, difficulty due to anxiety and stress because of the change in environment, so I think it will be very helpful.
And also for those patients that have issues with mobility, I think too.
Yes, I totally agree. And we really hope that we can have that program at our center in the near future too.
Do we have a time frame on it, or is it just not up and running?
Not yet for Huntington patient. We currently have a spatial program called Legacy Care Program for Parkinson patient who has more advanced disease and have difficulty coming to the clinic. So we have a nurse who works dedicated at the program who will reach out to the patient by phone periodically. And also we have a comprehensive clinic for them, including the physical therapist, speech, occupational therapist, social worker who see them on the same day. And then they will have a tablet that they can use to communicate with us, when they cannot come to the hospital, and they can come to the hospital may perhaps less frequent, and then in between they can see us over the telemedicine help.
That'll be fantastic.
One more question for you. So what should we do when our HD patient is really, they're bed bound, they're homebound. It's very difficult to get them out of their bed and get them to a doctor. How do we manage their care with doctors?
Yes, so when we do not have the telemedicine available, it can be very difficult to bring the patient to the hospital. Transportation is one of the main issue. Depend on insurance. Certain insurance may able to help provide a more specialized transport to help the Huntington person to come to the doctor. I would recommend to plan to give the person plenty of time, give them plenty of time to prepare to come to the visit. And it depends on a person. Some patient who has a lot of cognitive problem, if you tell them too long in advance, they can be very anxious, and they can feel very stressful. So in some situation, it may be easier to just tell them, let's say the night before, or just that morning that, okay, you have to go to the doctor. We're going to, plan like this, and, give extra plenty of time to come to the hospital. And in some situation, I can see it can be very hard. I do have patient who has very advanced disease, and it's very difficult for the family to bring them to the hospital because of the transportation. So they may see us like once or twice a year. But in certain situation, if you have access to the doctor that can visit the person at home, that may be also a helpful, useful way to, let's say we have a home visit doctor, more frequent, and then perhaps once, twice a year, you can bring the person to see the Huntington specialist or movement disorder specialist.
Mm-hmm.
They actually have home visit doctors still?
Yes, there are certain doctors, certain practice that provide that. Or if the patient is in a, let's say, facility or group home, some facility will have, their own house doctor who actually very helpful, help manage all day-to-day problem, like manage, if the person have swallowing problem, they help kind of make sure, the nurse at the facility help make sure all the tube is working well. They help treat, constipation, or if the person has more anxiety problem, or have behavioral problem, they can have in-house doctor who help manage kind of more of these day-to-day problem. And let's say for the involuntary movement such as Korea, if they need more specialist help, then the Huntington person can be transported to the clinic. One interesting thing is also, as Huntington disease become more advanced, the involuntary movement such as Korea actually can subside. So it can slowly progress earlier in the course of the disease through the mid stage of the disease. And as the disease become more advanced, the chorea usually goes away, and the person may have more of the stiffness and slowness instead of the involuntary movement. So they end up need less of the specialty drug that the regular doctor may not be familiar with. And then physical occupational therapy will be more important to them, than, some of these anti-chorea drug that they used to need in the past.
Dr. O, quick question. I'm wondering about exercise. When I think of living well, I think absolutely what we put in our bodies and the food that we eat impacts how we feel and physically and emotionally. But how about exercise for somebody with Huntington's?
That is very good question. Exercise, there's a lot of research going on in other diseases such as Parkinson disease, and has been shown huge impact, huge benefit on Parkinson symptoms. And also in HD person is also very helpful. However, it depends on what stage of the disease you are. Early on, a person is likely to be able to exercise on their own, and they can do any exercise that they like. I actually have many Huntington patients who still early on in the course of the disease, and they exercise regularly. They go to the gym, they do cardio exercise, they do lift weight, they do more of yoga, tai chi, all those exercise, and they have been able to maintain their symptoms, pretty long, and seems to be relatively fit, despite the disease. However, as the disease progresses, the cognitive function become more affected, the balance and the coordination become more affected. So it would be helpful to actually seek help from professionals such as physical and occupational therapists to help evaluate and see which kind of exercise is appropriate and safe for you, so that you're not falling and injure yourself during the exercise. Because the coordination problem, the balance problem, and the involuntary movement can put you at risk of injuries and falls. So it'd be helpful to get evaluated by the therapist.
Makes sense.
Work for you.
Right. But maybe like I don't want to say low key, but chair exercise, those kind of things might be safer, or generally safe for a person. And then to go to the more advanced level, having a conversation with your physician too, or I don't know.
Correct. I have to say, as the disease become more advanced, sometimes sitting exercise will be safer for the person. Either try the stationary bike or just sitting and stretching your arms, your legs can be more safe and also help prevent the stiffness from the disease. And as the disease become more advanced, it is more likely that the Huntington person will need help from someone else to help them exercise, which will be most likely to help, stretching, and strengthening the limbs, make sure they get stretched, the arms, the legs, help get them up and walk with them to prevent them from falls. So as the disease become more advanced, it will be more likely that they will need the help from you or from the therapist to help initiate and do the exercise for them.
One thing that I've found with my own HD person is there will be times when maybe he was ill for a while and then becomes very deconditioned. Mm-hmm. And so I'm working with his primary care physician to, order home health to come and evaluate for PT and OT. And that can go on, periodically throughout the course of the disease progression. That is one thing that I found has been very helpful.
Yes. Mm-hmm. Yes, totally right. So discuss with your doctors and see if they can order the, speech swallow therapist, occupational therapist, and physical therapist for Huntington person. And as the disease advances, they can have the therapist visit the person at home and do everything at home. Sorry.
That's wonderful. This has been just a great amount of information, actually, and real practical. I don't know if anybody else who's on, if you'd like to ask a question, you can feel free to unmute yourself and ask that question. You might not be in front of a computer, and so if you can't type it in, feel free to do that. Just going to give you a minute to do that if you have another question. Okay. I think then we probably need to let Dr. O get back to seeing her next patient.
Okay, well, it's my pleasure talking to all of you again. And thank you so much for the opportunity.
Thank you,
so
Dr.
much.
O.
Nice seeing you all. Take care.
Thanks. Bye-bye. And the people who are here, just so you know, Melissa, as Melissa said, she'll put this up and this information up, as well as where the support groups are, the online support groups that you can access.
So I just want to tell everybody too, PMD Alliance has provided this platform for us to have Lunch with Docs HD every third Tuesday of the month. We do have some special editions, which is what we're doing today, but I want to thank PMD Alliance for providing this platform for us, and also Teva Pharmaceuticals for putting the funding together for us with this program. So thank you, everyone. Tune in again to Lunch with Docs HD.